Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we will discuss the second part of kidney stones, including treatment options, potential complications, dietary and lifestyle changes, long-term management, and follow-up care. Treatment options. The size, location, and kind of kidney stone, together with the intensity of symptoms and the existence of any complications, all influence how the stone is treated. Options for treatment range from medicinal interventions and surgical procedures to conservative management and lifestyle modifications. 1. Conservative management. Small stones, usually less than 5 mm in diameter, that are likely to pass on their own can be treated conservatively. This strategy includes monitoring, hydration, and pain treatment. Important elements consist of pain relief. Ibuprofen, acetaminophen, or naproxen are examples of over-the-counter pain medications that can help control kidney stone discomfort. Prescription drugs like opioids may be required for more severe pain. Hydration. It's critical to consume a lot of liquids to aid in the urinary tract stones removal. Patients are frequently told to consume enough water to yield urine that is clear or pale yellow in color. Medical expulsive therapy. Drugs like tamsulosin, an alpha blocker, can relax the muscles of the ureter, facilitating the passage of kidney stones. For stones in the lower ureter, medical expulsive therapy is usually employed. 2. Medical interventions. These may be required if the stones do not go away on their own or if they are causing serious symptoms. Among these are extracorporeal shock wave lithotripsy, ESWL, is a non-invasive technique that breaks kidney stones into more easily pass-through pieces by using shock waves. For kidney or upper ureter stones, it is frequently utilized. Ureteroscopy. This procedure uses a thin, flexible tube called a ureteroscope to access the kidney and ureter by passing it via the bladder and urethra. The stone can be seen and then either removed with a basket or laser cut into smaller pieces. Percutaneous nephrolithotomy, PCNL, is a minimally invasive surgical procedure used for large or complex kidney stones. To remove or break up the stone, a tiny incision is made in the back and a nephroscope is placed directly into the kidney. Open or laparoscopic surgery. This surgery may be necessary to remove the stone in rare instances where other treatments are ineffective. This is typically saved for really big stones or stones that seriously obstruct a path. 3. Preventive strategies. The main goal following kidney stone treatment is to avoid recurrence. Among the preventive techniques are dietary modifications. Changing one's diet significantly lowers the chance of developing stones in the future. It may be advised to drink more water, limit meals high in salt and oxalate, and continue to get a balanced diet of calcium. Medications. To stop the production of stones, doctors may prescribe medication to people who are at a high risk of recurrence. These could include potassium citrate, to alkalinize the urine, thiazide diuretics, to lower calcium levels, and allopurinol, to lower uric acid levels. Regular monitoring. It is crucial to schedule routine checkups with a healthcare professional to monitor kidney function, urine composition, and the success of preventative treatments. Complications of kidney stones. While most kidney stones move through the urinary canal without creating any major issues, bigger stones, or those that become lodged in the tract, might cause troubles. If these problems are not treated right away, they may result in major health problems. 1. Urinary tract obstruction. Urine can back up into the kidneys due to obstructions caused by kidney stones. This may result in hydronephrosis, a disorder where urine builds up and causes swelling in the kidneys. If left untreated, hydronephrosis can result in diminished kidney function or even renal failure, as well as lifelong kidney damage. 2. Urinary tract infections. UTIs. By giving germs a place to grow, kidney stones can raise the risk of UTIs. Urine can get infected when a stone obstructs the urinary tract and prevents it from being completely evacuated. UTI symptoms include fever, cloudy or foul-smelling urine, pain or burning when urinating, and frequent urination. Infections that extend to the kidneys can result in pyelonephritis, a dangerous illness that needs to be treated right away. 3. Chronic kidney disease, CKD. Recurrent kidney stones may eventually result in chronic kidney disease, especially if they block the kidneys or cause recurrent infections. Chronic kidney disease, CKD, is a degenerative illness that causes the kidneys to progressively lose their capacity to remove waste products and extra fluid from the blood. This condition can proceed to end-stage renal disease, ESRD, which calls for dialysis or kidney transplantation. 4. Sepsis. Seldom may a kidney stone that triggers a serious infection result in sepsis. This is a potentially fatal illness where the body's reaction to an infection results in extensive inflammation and organ failure. Sepsis is characterized by a high fever, fast heartbeat, dyspnea, disorientation, and excruciating pain. Sepsis is a medical emergency that needs to be treated with fluids and antibiotics right away, as well as quick hospitalization. 5. Recurrent stone formation. People who have already had a kidney stone are more likely to get more in the future. Because recurrent stone development can result in a loop of recurrent problems, therapies, and symptoms, long-term care and prevention are crucial. Lifestyle and dietary modifications. Making dietary and lifestyle adjustments that lower the risk of stone formation is part of kidney stone prevention. These adjustments are made based on the particular kind of stone that a person is most likely to grow. For instance, a person with a history of calcium oxalate stones might need to reduce the amount of oxalate-rich foods they eat, while a person with uric acid stones might need to change how much protein they eat. 1. Hydration. One of the best strategies to avoid kidney stones is to maintain adequate hydration. Getting adequate water dilutes the compounds in urine that can crystallize. Although most adults should drink 2 to 3 liters of water a day, the precise amount may vary depending on factors including climate, degree of exercise, and general health. It's important to stay hydrated throughout the day, and replacing lost fluids through perspiration during hot weather or after intense exertion requires drinking extra water. 2. Dietary calcium. In contrast to common opinion, it is typically not advised to reduce dietary calcium in order to prevent calcium stones. In actuality, kidney stones can become more common in a diet lacking in calcium. In the intestines, calcium forms a bond with oxalate to stop it from entering the bloodstream and producing stones. The idea is to consume enough calcium from food, such as dairy products, leafy greens, and fortified foods. It is important to stay away from taking excessive amounts of calcium supplements unless medically advised. 3. Oxalate-rich foods. Cutting back on oxalate-rich meals may help avoid the formation of stones in people who are susceptible to calcium oxalate stones. Foods high in oxalate include chocolate, almonds, beets, spinach, rhubarb, and some berries. To lessen oxalate absorption, it's usually more beneficial to combine these foods with foods high in calcium rather than completely removing them from your diet. 4. Sodium intake. Consuming a lot of sodium might cause the body to excrete more calcium in the urine, which increases the chance of developing calcium stones. Kidney stones can be prevented by cutting back on salt in the diet by selecting low-sodium foods, avoiding salting meals, and consuming fewer processed foods. A daily intake of no more than 2,300 mg of salt is advised, with a preferred limit of 1,500 mg for individuals who are susceptible to kidney stones. 5. Consumption of protein. Eating a lot of animal protein, such as from red meat, chicken, eggs, and seafood, can raise your chance of developing calcium and uric acid stones. Animal protein decreases citrate levels, which aid in the prevention of stone formation, and increases uric acid levels in the urine. The risk of stone formation can be decreased by consuming moderate amounts of protein and opting for more plant-based proteins, such as those found in nuts, tofu, and legumes. 6. Citrate-rich foods. Citrate inhibits the development of calcium crystals in the urine by binding with it, making it a natural stone prevention agent. Kidney stones can be prevented by eating foods high in citrate, such as oranges, lemons, and other citrus fruits. Supplemental citrate may be beneficial for certain individuals, however, this should be explored with a healthcare professional. 7. Keeping a healthy weight. Metabolic syndrome and obesity are linked to a higher incidence of kidney stones, especially uric acid stones. A balanced diet and frequent exercise can help maintain a healthy weight and lower the risk. Extreme dieting and quick weight reduction, however, should be avoided as they may raise the risk of stone formation. 8. Restrict meals high in purines. Purines are chemicals present in some meals that might cause urine to become more acidic, which increases the risk of uric acid stones. Sardines, anchovies, organ meats, and several kinds of shellfish are foods high in purines. Reducing the consumption of certain foods can help lower the risk of kidney stones. Long-term management and follow-up. Long-term care and routine follow-up are crucial for kidney stone sufferers in order to avoid recurrence. The long-term management strategy is customized based on the risk factors, stone composition, and any underlying medical conditions of the patient. Important elements of long-term administration consist of frequent monitoring. It's critical to visit a doctor on a regular basis to evaluate kidney function, the makeup of the urine, and the development of stones. Periodic imaging exams, blood tests, and 24-hour urine collection may be necessary to evaluate elements such as urine volume, pH, and the presence of chemicals that can cause stones. Medications. They may be administered to prevent the recurrence of the stone, depending on its form and underlying risk factors. For example, thiazide diuretics. These drugs are helpful for those who have calcium stones because they lessen the quantity of calcium expelled in the urine. Potassium citrate. This drug is useful in preventing both uric acid and calcium stones because it lowers urine acidity and raises urine citrate levels. Allopurinol. This drug is used to treat gout or high blood uric acid levels in order to reduce uric acid levels and avoid uric acid stones. Antibiotics. Long-term antibiotics may be recommended to prevent infection-related stone formation in cases when kidney stones are linked to recurrent urinary tract infections. Lifestyle modifications. Maintaining adherence to dietary and lifestyle changes is essential to preventing kidney stone recurrence. This entails drinking enough water, eating a healthy diet, and taking care of any underlying medical issues that could be causing the stone to form. Patient education. Effective long-term therapy of kidney stones requires educating people about the risk factors for the condition, the value of prevention, and how to spot the early signs of stone formation. It is important to advise patients to get medical help as soon as they suspect kidney stones or a urinary tract infection. Supportive care. A multidisciplinary team comprising urologists, nephrologists, and dietitians may be able to provide helpful care for those who get kidney stones on a regular or recurrent basis. By addressing the many variables that contribute to stone formation, this team-based approach can enhance results in general. A frequent and possibly painful condition that can have a major effect on a person's quality of life are kidney stones. While a number of factors, including genetics, nutrition, and lifestyle, can influence the formation of kidney stones, good management and prevention techniques can help limit problems. These strategies can also reduce the chance of recurrence. By being aware of the causes, symptoms, and available treatment options for kidney stones, people can take proactive measures to preserve kidney health and avoid kidney stones in the future. Individuals who are susceptible to kidney stones can lower their chance of experiencing another episode by adopting a more informed lifestyle and drinking enough water. Additionally, regularly visiting their doctor can help improve their general health. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.